What's up, YouTube? I am showing you how to register patients today. Why am I showing you this? Because there are multiple jobs in an area called patient registration, patient services, patient representative, etc., etc. So, registering a patient is really putting in the new patient information into the database. So, all different hospitals use different types of computers, and they will train you on your particular software. But knowing the general job responsibilities of a patient registration individual may help you decide if this is a career for you. To the left hand side here, we have first name, last name, and date of birth. We have the address, gender, marital status. All of these items are considered patient demographics. So if you see entering patient demographics, all that means is first name, last name, date of birth, address, social security number, marital status, any information that will give you details on the patient. If there's any other work information, you can enter it, but it is not required for the medical record. The biggest requirement is going to be these patient demographics that we see here on the left-hand side. So once we save our patient information, our patient's information will be saved in the database. And not only will you have to enter the information as you saw there, you will have to learn how to search for information of your patients. Typically, there is a search box or a search button where you can look for last name, first name. You could search by email. There are instances where patients may have the same name. How do we determine if it's the same patient? Well, we can look at their date of birth. If the date of birth is the same, we can also look at their patient ID or their medical record number. If I change the patient here, you see the medical record number changes to 80, or the patient ID, same thing. Okay. So once we know that we have our patient in the system, we now have created a chart for them of which the doctors can enter information. If you are a patient registration professional, you may be asked to also schedule a patient for an appointment. A lot of the software you use to register patients is also the same software that you can schedule a patient. So I've registered my patient in the system, and now I am going to give my patient an appointment. The key thing to actually making sure that you have a good appointment is asking your patient to repeat the time, making sure that you have the right doctor. As you can see up here to the left, this is Dr. Finchman. You need to make sure you're scheduling for the right provider, because if I change to a different doctor, like Dr. Smith, as you see up here, you see that Dr. Smith does have a schedule. So, really knowing how to navigate the patient information, you may also be responsible for entering some sort of complaints or any diagnoses into the patient's chart. Maybe you're responsible for documenting the first area of care, and for a chief complaint for a visit, maybe they're having neck pain or headache, earache, or congestion. Or maybe you have to put in a diagnosis of a patient. As I am entering here, searching the database, this patient has had chickenpox. So we are entering chickenpox into the system. So we have created an encounter. We see that our patient has an earache. To the bottom right, we see our patient has the chickenpox. So those are just some of the basic skills, entering the signs and symptoms or diagnosis so that the record can be ready for the provider. Or we may be scheduling appointments for different doctors, or we may be going in to register the patient. Either way, the information that is entered into the computer has to be secure and safe and kept private. Now, if you do not have any of these skills, guess what? I am going to be running a free training class on how to work all of these items inside of the medical record. You'll know how to search a patient. You'll know how to add insurance to a patient. You'll know how to schedule and use all of those technical skills. I actually have a free software that you can use, very similar to what you see me using on the screen, and you'll be able to follow along with me and gain some of those skills in the medical field. You may be surprised. Maybe you've already used some sort of scheduling software before in the past, and this is very similar to what you have done. Remember, we can apply some of our older skills as well. So, if any of you are interested in learning how to do a patient registration, this is something that you definitely should let me know. The average salary we have here, base pay of $34,000 with years of experience, having some technical skills, having a little bit more education. Maybe you've worked in the medical field before in a different capacity as a nursing assistant or a home health aide, or maybe you've worked in a business office before scheduling appointments or running a schedule, and you want to use those customer service and client skills in the field. If I see the full career path here, there are a lot of different jobs here in the field, and the average year's experience, 45% of the people that get into patient registration, 45% of them have 0 to 1 year experience. So definitely make sure this is something you look into if you're interested in getting into the medical field and potentially working remote. In my next video, I will be going over some of those remote jobs and showing you how you can get to these free training classes. If you're interested in learning how to do patient registration online and work remote, let me know in the comments, and you can join my live and learn how to do any of these technical skills. Here I am getting the patient's chart. You see that there is encounters and information inside of the patient's chart. There may be medication. So this is very comprehensive. You can have an entry level job all the way up to a very advanced level job, making great money working from home. So if this is something you think you're interested in, please let me know, like and subscribe, and let me know in the comments that you are interested in my free training class. Thank you for joining me today. I am Carla from Carla's Career Counseling and Training. You can always join me here for your free training and remote medical job needs. Have a great day, everybody, and take care.